Tuesday, April 28th, 2020. Joe Delaronde, Jets. Welcome to today's COVID-19 Task Force Daily Update. There is plenty on the docket today. Lisa Westaway and Lloyd Phillips will both be in with plenty to say today. But before we do that, the biggest news has been the Premier of Quebec announcing that schools will be back, some of them anyway. Kahnawake has made its own decision on what will be happening and transpiring here within our community. And to talk about that is the director of the Kahnawake Education Centre, Robin Delaronde. Robin, all yours.
Everyone. Pleased to be here once again to give you an update on the occurrence, as Joe had said, with the recent announcement about schools reopening, primarily for the elementary sector in the province. I'm going to touch on a few updates today and information, basically giving information about Kahnawake's decision. In terms of what we will be doing and in terms of the rest of the school year, and what decisions and facts and reasoning we used to base our decisions on in terms of not reopening our schools in Kahnawake for the remainder of the school year. I'm also going to talk about surveys and supports that we will be providing and sending out to parents in relation to daycares and needs that people may require in the coming months, and other items, various items that I know people have been wondering about that are related to education, like graduation and what will happen and so forth. So first of all, just want to talk about the reasonings behind why Kahnawake we decided not to reopen the schools, as of course obviously that differs from the province's decision. One of the main reasons for not reopening is that all of the decisions that we make for Kahnawake are basically based on the medical and the health reasonings and information that we get at the COVID task force on the state of the situation and what we see is happening in Kahnawake and what we hope to happen for the health and well-being of our family, our community, and our students. So that was one of the main factors in deciding to not open our school system as the province has done. The second factor is that we as education system really want to make sure that the opening, and when we do open our schools, that is done in accordance with a real sound judgment, sound planning that will ensure the safety and well-being for our employees, for the students, for families. So we really want to make sure that we have the proper planning, the proper measures in place, and not to be rushed and make decisions that are not in the best interest for people who would be returning to our schools. So that was another deciding factor in reasoning why we were not doing that. We also are aware and know that within the community there are plans in the process of what would it look like when Kahnawake does begin to reopen. What are the impacts, whether it will open businesses, organizations, different sectors. We want to make sure that we are doing openings and communicating this properly and do this in accordance with a solid plan that is similar and follows the same progression. Other factors is that in Kahnawake, and as even communities in the province, schools in the province, our educators and our support staff are going through also some challenges, like every one of us, in terms of being at home and juggling multiple responsibilities, trying to educate. Some are caring for families and elderly. There's different various situations that everyone is feeling at this time. And we really must take stock of what is currently happening with our educators, what are they facing, what are the challenges, and plan accordingly for their return back to the school as well. So these are other factors that made the decision. Other situations that we're facing and what we want to do in Kahnawake and for the Kahnawake education system is we want to take this time to really plan and prepare both our school systems and our educators for possibilities that are forthcoming, meaning we want to provide them with essential resources, educational services, and professional development specifically for online learning. So we are making a plan and have plans in place to ensure that they receive services, they've received professional development that will support them in the delivery of education services, possibly in the fall if we are faced with that type of situation where our students may be faced and our families faced with the potential that we may be providing, once again, online learning. We may be looking at and exploring other alternatives such as blended learning. We are looking at all possibilities, and we want to reassure you that we have a team together that's looking at what Kahnawake education could look like and may look like when our students return in the fall. And we really need to utilize this time to fully prepare everyone for that. We are looking at solutions such as alternative schedules. We may look at situations where high school would have online learning more so than the elementary. We are looking at ensuring that classrooms are fully prepared, and that if we need to make guidelines and follow guidelines for social distancing, how would we do that in the school? We are looking at so many creative ways and plans right now that it does take a lot of our resources, and we want to make sure that it's done appropriately and we're ready for students in the fall. So those are some of the reasons why we decided, and the COVID task force supported the decision to not open our schools. Now, currently, we are servicing our students either through resources, online services, either through the 10s and 11s receiving classes online with their teachers. I'd like to thank them for doing that. I'd like to thank all the educators out there who are supporting students, giving that call, reaching out to them, finding out to students how they're doing, and being there to support in whatever way they can. So we do know, and I do know, that our staff are engaged in and really dedicated to the learning and care for our students. One of the other things that we've been working on in education is we have been providing our educators right now with professional development, so there is a lot of ongoing, and it will continue up until June, and then we will make plans for our educators after that. One of the discussions I know is that with the elementary students, we understand that there are many things and challenges that we face in terms of supporting elementary students and the families. We are also anticipating, both as education system but also as the daycares, and I'm speaking here on behalf for Natalie Bova from the Step by Step and the daycare sector, is that currently we are providing supports to families who are essential services, who require that service, and other clientele right now. We do anticipate and are in the plans to begin to explore other services we can provide for families with this announcement. We know that the daycares as well were given the mandate from the province to also open soon. But as of today, the COVID task force, we have agreed and supported Natalie to not follow the specific mandates that are in place, but she will follow the mandates that the COVID task force we have recommended, which is that everything that she's currently providing in terms of services at the daycares are status quo, and the same for the daycares for the 6 and 12-year-olds that are being run at the Kahnawake Youth Center. We are anticipating what could possibly be a gradual reopening of the business or the organization sector in the community, so we know that there's plans for that. We know and are aware that this could impact services parents need either between now and May and June and throughout the summer. So we are going to be making a plan to address those potential needs of services that parents may be requesting and may be needing. What we are going to be doing is, I know we're going to be compiling surveys and outreach to families. We are, and please expect that there will be calls to you. I know that Step by Step has coordinated and developed a survey with various questions, and myself and other schools will be utilizing the survey and reaching out to you. So please expect in the near future that you will receive a call. What we want to do is gather information from you and anticipate that should the business sectors begin to open gradually, should you as parents be returning back to your organization to work, would you require services for daycare? So we would like to do a survey that would gather all this information and the needs as well. So we will be reaching out to you. We also know that and are aware that we have approximately 87 students who are affected by the announcement for provincial schools to return, which is, we know, not mandatory. So we know that we have 87 elementary students who go to outside provincial schools for elementary, and we will be calling you as well and reaching out to see how we can support you and what your intentions are as well. So these are some of the things that we want to inform the community, that we are here, we are anticipating short-term plans, but we really are looking at long-term plans and the impacts it can have for you as parents, for us as a community, and for your child. So just to reassure you that we are looking at all aspects. One of the other questions that obviously we've seen and that has come about with this announcement in terms of schools not reopening, that means, and there has been a lot of questions about what will graduation look like. What would happen with our students, for our students at this time? So what we've been able to do is put together a subcommittee within each of our schools to generate ideas about what graduation would look like under the directives that we must follow right now. So I have to congratulate each of the 3 schools who have come up with ideas, that respect social distancing and so forth. And with that procedure and ideas that they have, would still have to come to the COVID task force to review, which we're going to be doing, and we will get back to parents shortly to inform them about what plans would be acceptable for graduation, because we really want to acknowledge all our graduates and have some form of celebration with them. I also received information, and I'll give credit to Jolie Van Domelen, who put together another idea and forwarded to me regarding other ideas to celebrate our graduates, not only graduates from elementary and high school, but also looking at graduates from all our schools, even from post-secondary and so forth, and finding some way as a community to recognize them all and celebrate them during this time. So we will give more information on that as it unfolds. So overall, I just want to say that I am really feel very good about the decision. I'm very confident that we have made a good decision in terms of not opening up our doors for our children to come back to the schools. And we will be and continue to provide services to the families, to parents, to the students in the coming months. And would like to say that we are planning in the long term to see what our school system would look like and what learning will look like in September. So we will keep you advised and keep you informed of matters as they evolve. And I wish you all the best. And that's basically my report for this time. So, Kahnawake.
Robin Delaronde, thank you very much. Obviously, a very, very busy time. Boy. Speaking of busy, Lisa Westaway joins us from the Cattery Memorial Hospital Centre. She's the Executive Director, and she'll keep you up to date on what's happening in her world. Lisa?
Hi, good afternoon. I really, on behalf of KMHC and especially on behalf of the staff in inpatient, I would like to offer our deepest condolences to family members whose loved ones have passed away. Over the past few weeks, there have been 3 deaths at KMHC. And you may know about this, but out of respect for the families, I'm not going to mention their names, but I have spoken with, or Gail has spoken with the families, and they have given me permission to speak to you today to reassure you that these deaths were not COVID-19 related. So the deaths of these 3 people were a normal part of the progression of disease, and we're unfortunate at this time. So this is a really difficult time for family, for all involved, because we are not able to grieve in the way that we normally would. So I just, again, would like to acknowledge how difficult this has been and offer my deepest condolences to all of you during this difficult time. Thank you.
All right, thank you very much, Lisa. Today was a particularly long day at the COVID-19 task force. The meeting actually ended much later, which is why we're actually bringing you this report a little later than we usually do. So I would like to bring on our Commissioner of Public Safety, Lloyd Phillips, who will be our final speaker today, and he'll give you the update and the reasons why today took so long. Lloyd?
Again, clean my hands just before I came on here. Thank you, Joe, Lisa, and Robin for that that update. Certainly, some major developments, in the education field, as well as along with Step by Step and the youth center. And so they're all kind of interlinked in various ways to ensure that our children are properly taken care of. Yeah, today we had a fairly long session with the COVID task force. We did have Dr. Anik Goche along with us, and made a very good presentation and explanation behind the science of reopening. Where we are now, where we are on a virtual shutdown of businesses and shutdown in the community, essential services only, communities for residents only. And how to, what is the science behind it? When we start opening back up, what are the impacts on the community? What's impacts on our population? And how is the best way to move forward from there? So she gave us a very good explanation, and we'll look at maybe summarizing that, in the next day or two, and provide the information to the community as well. But it was very comprehensive, but also very enlightening for all the members of the task force to really hear the real important messages that she had to relay, and I'll touch on a few of them in just a few minutes. But before I get into that, as probably some of you already have heard, if not, you'll hear on the news that Quebec had announced its plan to start the reopening of various businesses within the province of Quebec, starting as early as next week, May 4th. Various retail outlets will be allowed to open under certain parameters. And then after that, on a weekly basis, gradually reopening the economy to once again return back to close to what it was prior to the pandemic starting. Obviously that raises some concern from the task force, because as we mentioned before, we are in the process of developing a Kahnawake plan, a plan that makes sense for our community. Because as we stated many times before, and it's crucial, and Dr. Goche will back me up 100% on this, that our community is more vulnerable. Our population is different than it is of Chateauguay and our neighbors. So we have to be more calculated. We have to be more careful on how we're going to go about doing things in Kahnawake. So we are making that plan for the community. We're going to be presenting it back to the community when it's all developed. But again, we need to be clear and very calculated on what we need to put in place before we decide when we're going to turn that key. Because right now, from everything that we were told, what Quebec is doing, for one, we believe they're moving much too quickly, and the science does not back up what they're doing. No, what they would normally do, and this is information that we received today, when the pandemic broke out, for every one person that got infected, they infected on the average of 5 people. And that was before the measures were put into place. Once the measures were put into place and we came to a basic lockdown in the community, but also across the entire province, where they had social distancing rules, stay home rules, and all the other things that were put into place, that number dropped from 1 to 1.1. So just a little more. For one person that gets infected, they would just do slightly more than one person additional that would infect. But that's still not viewed to be under control. What you want to see is, if one person is infected, the rate of spread is less than one person. So it may take 2 people to infect one person, for example. So it's like one person to infect 0.8. So in other words, it's under control, because just because there's one person infected, it doesn't necessarily mean that it's going to infect somebody else. But right now, we're still at that level where it's not deemed to be under control according to the scientific data. Because one thing we do know for sure is, when the economy opens up and more people start circulating in and around the community, or in this case, even in Quebec and in our neighboring communities, the numbers of infections will rise. That's a sure thing. And there's evidence of this across the globe, where other countries and jurisdictions have dealt with the pandemic and have shut down and start to reopen. As soon as you start reopening, those numbers will spike. And so you got to be very careful on how fast you open, and be very calculated, as I mentioned, because if you open too quickly, you may have that number spike to a point that you'll lose control over the rate of infection. Higher rate of infection, higher rate of possibility people becoming very sick, higher rate of possibility of death. So that is what we have to really keep in mind here moving forward. Nobody is opposed to reopening the economy. Nobody's opposed to reopening businesses. But again, calculated and based on science and based on making sure that we're doing it in the best interest of our community, irregardless of what the province is doing. We have to make sure Kahnawake is safe first and foremost. We have to also keep in mind that there's other factors that we have to put into place to ensure that the proper rollout happens. And a few things that we need to put in place, as I mentioned yesterday, we have to make sure that we have our health inspectors consolidated and that they're able to be out and around the community to make sure that the proper safety procedures are being followed and put into place. Because even if we start rolling out the economy and business start to reopen, it ain't going to be the way it was prior. There's still going to be measures in place that will include social distancing, include hand washing stations, include various other things that to ensure, again, maximum safety for the employee as much as the people going into the store or the retail outlet. So these things need to be in place. As well as we're looking at a health team to be put into place to support businesses and support the people creating the plan to ensure whatever health aspects and clarification need to be done, that we have a team in place that's there to support them. As well as a team looking at how can we best deal with the psychological impacts from the opening of businesses. Because there's a very wide spectrum of people out there. Some people are ready to go tomorrow and go to work and do what they got to do, whereas you have other people on the other spectrum who are fearful and are afraid to go out and associate with a lot of people. So there's a wide spectrum there of individuals. So what we have to do is make sure that they're educated properly, they understand the safety precautions are there to support them, but also if they're feeling that anxiety and they're feeling that stress and stuff, that we have the support mechanisms there to be able to properly support them. So there's some of these elements that got to be put into place so that we're not only looking after the interests of the business, we're looking at the interest of the employees who are working in those businesses, the interest of the health of people coming in and out of those businesses. So I think it's very important to make sure those are all put into place. No, and part of the health aspect as well includes testing. We do have the testing facility within our community that is a great benefit to what we have in terms of tools. But going forward, we have this availability to us. So when things are opening up, we can have that proper testing in place to see if we're having those spikes in the number of infections in our community, and adjust our strategy accordingly. But if we roll this out in a proper manner, hopefully we won't see too much of a spike. But we'll have the tools in place with the health team to ensure it's managed in a proper way. But keep in mind, we will see those spikes. And again, this happened around the world already. But we need to be preparing that for our community. What we're looking at in the next while about the reopening of the economy, the way it was put forward is it's a huge and serious social experiment. Nobody has the forethought or the knowledge of how this will impact a community, a country, a province, which we've seen around the world. So it is a what is being called a social experiment, but it's more than that. And here is some reality. When we open the economy and things start to move, we will see increased rates of infection, and we will see the probability of people contracting the disease and dying. So what decisions, and it's burden upon the task force and our community as a whole. Keep in mind, the decisions that we make that may seem to be not associated with life and death are life and death decisions on how we move forward, reopening the economy. So we don't take that lightly whatsoever in the task force, and nor should any community member or any business person out there, understanding that there are direct consequences to what we are doing moving forward. Again, that whole saying, we're all in this together, because we truly are, in that community sense, interconnected in various ways. As well, the impacts of what happened in Quebec. As I mentioned, in a week or so, Quebec's looking at open up certain businesses in the province of Quebec, including our neighbors around us. So that's definitely going to have an impact on us. We don't live on an island, we don't have that luxury. So what they do there will impact on us. But we have to make sure it has that minimal impact on our community. I know our community members are going to want to venture out and do certain things, which is your prerogative. But we still try to keep people to maintain at this point the same directives that we have put forward about stay local as much as possible, go out for essential services only, until we have a good grasp on the plan that we are moving forward. And we understand that people are maybe look towards Chateauguay, our neighbor, and say, well, business A and B are open. How come business A and B in Kahnawake are not opened? It's because the businesses in outside the community don't have the same population and don't have the same concerns that we have in Kahnawake. Like I said before, we're a very close community. We're very close-knit. We all know each other. We're all here together. That makes us very strong as a community, but it also makes us very vulnerable, because once those people, if somebody gets infected, it has the great possibility of spreading very rapidly to our community. So just keep that in mind moving forward, because like I said, the light is at the end of the tunnel. We see a path forward, but if we don't take that path in a proper way, all the hard work and all the sacrifice and all the financial resources and sacrifices our community did, including the business community, we might throw that out the window. So I really ask the community to be strong for a little while longer. Because like I said, we don't want to have to open the economy and start things moving forward, and then have to pull back. We know that'd be very difficult, and that'd be very difficult for the business people as well. If we say, okay, open up and things start looking positive from an economic perspective, but then medically things are wrong, and then we have to pull back. We know that's going to cause some problems in our community. It'll cause friction, and you know, it certainly won't go down a road that we want to go down. So that's why I ask the community to be patient and let us roll this out in a way that is feasible, you know, and for our community. A lot of very tough decisions need to be made over the next little while, and we're no stranger to that. That's why, like I said, we had that long meeting today where I think the full task force was really informed greatly on the magnitude of what is ahead of us. Because closing down the businesses and closing down the economy, going to essential services in our community was a major decision, and it was very, very difficult making those decisions, and they were made for the right reasons. And I want to make sure the opposite is true. Those decisions that are made for the right reasons, health and safety being the priority. And like I said, nobody's opposed to reopening the economy, but do it in a very calculated and a very safe manner, and to ensure the safety of our community. One more thing I just want to add, and I heard Arnold Lazard this morning on the radio, and he used an analogy which I really liked. You know, because you know, we're a very diverse community, and he used the example of driving that bus. You know, and as the public safety commissioner, you know, I'm at the driver's seat, and I have a great team supporting everything that we do. But we also have the community in that bus with us, and half that bus is telling us to hurry up, and the other half is telling us to slow down. Some are saying, you know, yes. Some are saying no. So we have to balance that all off based on the input from everybody that we have here, based on the science, and then keep moving forward. Because everything we do is linked. You know, opening the businesses, reopening the community organizations, how the schools are impacted, the daycare services for our children, the care for our elders, the health aspect, the social aspect. So there's many elements that need to be looked at. We need to make sure all these pieces are properly in place so that we roll things out as a community, we remain strong, and at the end of this, you know, we can be very proud to look back and see the response of our community was second to none. And that's what I'm striving for Kahnawake, and let's be strong for a little while longer. Yamagoa.
Thank you very much, Lloyd. Just a couple of notes. First of all, I just want to thank Lisa for mentioning the people who have passed and acknowledging them, because as we've said before on this program, these have been very difficult times, not only from the COVID-19, but if you look with the blockade of the train tracks here in Kahnawake, there was a whole time here when we haven't been able to really acknowledge properly many of those who have passed. So to anyone who's lost a family member or a friend or even just an acquaintance, we wish you our condolences. Just a couple of notes. Thanks to Robin, who was here earlier, Robin Delaronde. She'll be on the K103.7 morning show tomorrow with Denon and Paul, along with Natalie Bova from Step by Step. And they'll be talking more at length about what some of Robin was talking about here. So they'll be able to flesh that out a little bit. And tomorrow there's lots more news coming out. Several initiatives will be announced. Some of them that we talked a little bit about, but more details come tomorrow. So I know there was a lot to absorb today. We hope that we've been able to help inform you a little bit more. We'll be back tomorrow, roughly the same time, somewhere between 4 and 5, with our daily COVID-19 task force update. So on behalf of all of us here today, we'd like to say thank you for watching, and we'll see you next time. Yauko Adano, Onigiwahi.